in high definition. This is KCAL 9 News at noon.
Also in our Health Watch, we know the Affordable Care Act takes effect in just a few months, and a lot of people have a lot of questions about how that new law is going to affect them. Sarah O'Leary is the owner of Exhale Health Care Advocates, and Sarah's here to help us get through it. Welcome, Sarah.
Thank you. Glad to be here.
So a lot of people are nervous about this. They have a lot of questions, but many health experts will say there's really nothing to be afraid of. This could be a wonderful thing.
And that really is our point of view. We're hopeful that it is going to be a system that helps average people and small businesses get more care than they've been offered in the past for less price. So beginning October 1st, people can enroll in the open enrollment system in covered California, and then on January 1st it will start for them.
Parts of the plan have already been implemented, though, and are already working.
Yes, and one of the key tenets was the idea that children under the age of 26 could stay on their parents' health care plan, and that happened in 2010, and it means 6 or 7 million more young adults are covered who weren't covered before.
What's the number one thing that people need to know as October 1st approaches? The concerns about open enrollment. A lot of people don't know what that means and what they should be doing to get ready.
It's a great question. Don't fear. Like we say, don't take healthcare candy from strangers. A lot of people with vested interests have created an environment of fear, which is really unfair. It's not going to be something that is catastrophic, that will change the lives of people in a bad way. We believe that October 1st, you can enroll, which means it's like going to Amazon. You can go onto a website if you do not have insurance, or if you have small business or individual plans, and you can go on, compare 13 different insurance companies, what they're going to offer to you. Compare, shop around, and make your decision. If you are confused by the system, Exhale Health will help people, but the government also has people in place that will help, and you can navigate the system. But you have a few months to get it figured out before it begins January 1st.
Now, is this something that people should be talking to their doctors about or their insurance carriers now if they have insurance?
Most people in the United States are covered under their employer's group plan, so it really doesn't affect them. They won't have a noticeable change. For the other people, what they need to do when they look into which policy to choose is identify what are the deductibles, what are the co-pays, what's the co-insurance, how should I look at this for my family uniquely, and how will it benefit? Will I get my doctor? Is my hospital in the network? These are things to consider. But really, to be an educated consumer is your best bet. And it's really only the tip of the iceberg, because once you get insurance, the number one reason for bankruptcy in the United States is medical bills. So you have to be vigilant all the time. We encourage people, we're like, this is just getting us started, but really look at overall what's happening in your family's life and your life before you decide on anything. And we're cautiously optimistic that the plan will really help people.
This is not a one-size-fits-all program.
No.
Everybody will have some different needs. And one of the big changes, though, is that people with pre-existing conditions no longer can be denied insurance, and that was a big problem in our country.
It is such a huge issue, and what people don't realize who have their employer as who gives them their insurance, individuals and small businesses would have to apply for their own insurance and could be denied for whatever reason the insurer decided was a legitimate reason. In the state of Michigan, a PPO there had decided that acne and erectile dysfunction would be enough to make you ineligible to receive care. And they paid a lot more, individuals paid a lot more for a lot less coverage. This now, with the Affordable Care Act, there are essential benefits that will be included, wellness, prevention. There will be things included for maternity care, which was a rider on a lot of the policies, even if you could get it. Mental health care. So there are a lot of really great things that are that they're trying to put in place. I'm very optimistic it'll be a good thing.
All right, Sarah, thank you for being here. Thanks for your expertise.